My name is Dr. John Santiago. I'm a physician anesthesiologist, and I work for the Permanente Physician Group for the Mid-Atlantic. One area that I specifically work in is in obstetrics and gynecology. I work in the labor and delivery deck, providing anesthetics. Generally, most people equate that to labor epidurals, C-sections, and things like that. An integrated model allows me to not only perform my job, the task of placing these things, but also knowing my patients well before they walk in the door. I know a heart condition that they may have. I know a gestational diabetes problem that they have. I know a lot of things that can cause a much higher risk profile for a patient, and it allows me to create a specific model for care for that patient at that time. People know of an opioid epidemic, and a lot of this can be tied to exposure to medications from surgeries as well. It's not uncommon to hear a story saying somebody received an ample amount of pain medication and then it had turned their lives in a negative direction. ERAS, Enhanced Recovery After Surgery, is what we consider a multimodal approach to pain control and recovery during surgery and after surgery as well. So in a nutshell, what it does is we use many different types of medications, not just opioids, but we use antiemetics, fluid restrictions, NSAIDs, different things that don't have the same type of risk profile as an opioid. Putting them all in conjunction, it's greater than the sum of its parts. So what it allows us to do is to give a patient just what they need to help with pain control, but it doesn't expose them to an excessive amount. A lot of times people consider surgery just as a focal event, but truly what happens is it is a stressful moment that affects an entire part of your life, and that stress ripples out. And because of that stress, sometimes people don't do well. By minimizing stress and risk, we're able to provide them with not only a good experience during a very traumatic event such as surgery, but make sure that they progress well.